Histrionic personality disorder represents a fascinating and complex mental health condition characterized by a pervasive pattern of excessive emotionality and attention-seeking behavior that begins by early adulthood and presents across various contexts. This disorder affects approximately 1 to 3% of the general population and is diagnosed more frequently in females than males, though this gender difference may reflect cultural biases in diagnosis rather than true prevalence differences. Individuals with histrionic personality disorder often appear vibrant, charismatic, and emotionally expressive on the surface, yet beneath this theatrical presentation lies a profound need for validation and approval that drives much of their behavior. The diagnostic criteria for histrionic personality disorder require the presence of at least 5 specific symptoms that create significant distress and impairment in functioning. These symptoms include discomfort in situations where they are not the center of attention, interaction with others that is often characterized by inappropriate sexually seductive or provocative behavior, rapidly shifting and shallow expression of emotions, consistently using physical appearance to draw attention to themselves, speech that is impressionistic and lacking in detail, theatrical self-dramatizing and exaggerated expression of emotion, being suggestible and easily influenced by others or circumstances, and considering relationships to be more intimate than they actually are. These criteria paint a picture of individuals who live their lives as if constantly performing on stage, seeking applause and validation from their audience. The development of histrionic personality disorder appears to stem from a complex interplay of genetic, psychological, and environmental factors that often trace back to early childhood experiences. Some researchers suggest that individuals who develop this disorder may have learned early in life that dramatic, attention-seeking behavior was the most effective way to receive care, attention, or affection from caregivers. Children who grow up in environments where emotional expression is either extremely suppressed or overly dramatic may develop histrionic traits as adaptive responses to their family dynamics. Additionally, families that place excessive emphasis on appearance, performance, or external validation may inadvertently foster the development of histrionic characteristics in susceptible children. Neurobiological research into histrionic personality disorder has revealed interesting patterns in brain structure and function, though the research is less extensive than for some other personality disorders. Studies suggest that individuals with histrionic personality disorder may have differences in brain regions associated with emotional processing and self-regulation. The limbic system, which processes emotions, may be hyperactive, contributing to the intense emotional reactions characteristic of the disorder. Additionally, areas of the brain responsible for impulse control and self-reflection may show reduced activity, potentially explaining the impulsive and externally focused nature of histrionic behavior. Living with histrionic personality disorder creates unique challenges that affect virtually every aspect of an individual's life. The constant need to be the center of attention can be exhausting both for the person with the disorder and for those around them. Relationships often become theatrical productions where every interaction is heightened and dramatized. While this can initially make individuals with histrionic personality disorder appear exciting and charismatic, the constant drama and need for attention can become overwhelming for friends, family members, and romantic partners over time. In romantic relationships, individuals with histrionic personality disorder often experience intense, passionate connections that may seem wonderful initially, but can become problematic as the relationship progresses. Their tendency to view relationships as more intimate than they actually are can lead to unrealistic expectations and disappointment when partners fail to meet their emotional needs. The seductive and provocative behavior that characterizes the disorder can create jealousy and trust issues in relationships, while their emotional volatility can make partners feel like they are constantly dealing with crises and drama. Professional settings present particular challenges for individuals with histrionic personality disorder. While their charisma and emotional expressiveness may be assets in certain careers such as entertainment, sales, or public relations, their need for constant attention and approval can interfere with teamwork and professional relationships. Their impressionistic communication style may frustrate colleagues who need specific details and concrete information. Additionally, their tendency to dramatize situations can make them appear unprofessional or unreliable in work environments that value stability and consistency. The emotional experience of individuals with histrionic personality disorder is characterized by intensity, but also by a certain superficiality that can be confusing to both themselves and others. While their emotions appear dramatic and overwhelming, they often shift rapidly and may lack the depth and consistency associated with more stable emotional experiences. This emotional volatility can make it difficult for individuals to develop genuine self-awareness or maintain consistent relationships with others. The constant focus on external validation means that their sense of self-worth depends heavily on the reactions and approval of others, creating a precarious foundation for psychological well-being. Diagnosing histrionic personality disorder requires careful assessment by qualified mental health professionals, as the symptoms can overlap with other conditions including narcissistic personality disorder, borderline personality disorder, and certain mood disorders. The diagnostic process involves comprehensive clinical interviews, psychological assessments, and careful observation of behavioral patterns across different settings and relationships. Clinicians must differentiate between the attention-seeking behavior characteristic of histrionic personality disorder and the grandiosity and exploitation associated with narcissistic personality disorder, or the emotional instability seen in borderline personality disorder. Treatment of histrionic personality disorder typically involves psychotherapy approaches that help individuals develop greater self-awareness, emotional regulation skills, and more authentic ways of relating to others. Cognitive behavioral therapy can be effective in helping individuals identify and challenge the thoughts and beliefs that drive their attention-seeking behavior. Psychodynamic therapy may help explore underlying emotional needs and childhood experiences that contribute to their current behavioral patterns. Group therapy can provide valuable opportunities to practice more genuine forms of interpersonal interaction and receive feedback about how their behavior affects others. One of the primary challenges in treating histrionic personality disorder is helping individuals develop a more authentic sense of self that is not dependent on external validation. This process often involves exploring the underlying fears and insecurities that drive the attention-seeking behavior, helping individuals recognize that they are worthy of love and acceptance even when they are not performing or seeking attention. Therapy may focus on developing emotional regulation skills, improving communication patterns, and learning to form deeper, more meaningful relationships based on genuine connection rather than theatrical performance. Family therapy can be particularly beneficial for individuals with histrionic personality disorder, as family dynamics often play significant roles in the development and maintenance of the disorder. Family members may need to learn how to respond differently to dramatic behavior, providing attention and validation for genuine emotional expression while not reinforcing theatrical or manipulative behaviors. Education about the disorder can help family members understand that the dramatic behavior stems from underlying emotional needs rather than deliberate manipulation. The prognosis for histrionic personality disorder varies significantly among individuals, with some experiencing substantial improvement through therapy while others continue to struggle with attention-seeking behaviors throughout their lives. Early intervention and consistent treatment can lead to meaningful improvements in emotional regulation, relationship satisfaction, and overall quality of life. However, the chronic nature of personality disorders means that ongoing support and maintenance therapy may be necessary for optimal outcomes. Research into histrionic personality disorder continues to evolve, with scientists investigating neurobiological factors, genetic predispositions, and environmental influences that contribute to its development. Advanced neuroimaging techniques are providing new insights into brain structure and function differences that may explain the emotional intensity and attention-seeking behaviors characteristic of the disorder. These findings offer hope for developing more targeted interventions and potentially preventive strategies in the future. Prevention efforts focus on early identification and intervention, particularly in children who may be showing early signs of dramatic attention-seeking behavior or emotional dysregulation. Creating supportive environments that provide appropriate attention and validation while teaching healthy emotional expression and self-regulation skills can help prevent the development of more problematic patterns. Despite the challenges associated with histrionic personality disorder, many individuals can achieve significant improvements in their emotional well-being and relationship satisfaction through appropriate treatment and support.